Hi, and welcome to today's webinar, COVID-19, Answering Your Burning HR Questions. Thank you for joining us today. Today we'll be discussing planning for the unknown, returning employees to a new work environment, workplace safety, emergency paid sick leave and emergency FMLA, tips on how to re-engage employees. We'll wrap things up, and then at the end we will have time for, hopefully we'll have some time for questions and answers. Our presenters today are Cheryl Zhang, she's an HR business partner in San Antonio. Norma Ray, she's our HR coordinator also in San Antonio, and John Titus, risk management consultant in San Antonio, and myself, I'm Miranda Wooten, human resources business partner in Denver. Before we get started, a couple housekeeping items. If everyone could please keep themselves muted during the presentation. If you have any questions, please feel free to ask them in the chat box below. We will try to get as many questions at the end of the presentation today. If we are unable to get to your questions, we will reach out to you directly. These slides and all supporting documentation will be sent to you following the presentation. I'm going to turn things over to Cheryl.
Thank you so much, Miranda, and welcome everyone. We're so glad you're here today. So as we start planning for the unknown, one of the things we have to look at is our current event. And I know most of us are thinking the same thing. What is going on with 2020? We've had enough, let's stop now. So there is quite a bit going on. And as we're working through all these issues, even in the last 3 weeks, there's a lot that has happened that us as businesses, we're kind of a microcosm of the country and the world. And while our ideas or opinions or positions on some of these may not mesh with others, it is important that we're still creating a workplace where all of our employees feel they can contribute to the business at hand, that we're working together for the sake of the company, for the sake of our customers, and for the sake of each other. So navigating that is something that we're having to do a lot of right now, and we're here to help. I will say that this is an extraordinary time, and your HR professionals, your third-party business partners, those are folks right now in the HR community who can help you with this. That doesn't mean they're going to tell you which answer is right or wrong. That means they are uniquely qualified to bring your workplace together. So engage those folks, again, whether they're in-house or third-party consultants. Those are the folks that really can bring your employees together and help y'all move through this. So besides COVID-19 and the pandemic right now, some other things that happened over the last few weeks, and you can see them listed here. We've got quite a bit of racial protests going on, racially charged conversations, and those are things that, again, that's going to come into your workforce. And I'm gonna give a good example. What you want to be doing here is listening. I'll give you a good example in a minute. One of the things you want to do is listening to everybody, making sure they feel safe in the workplace, and that people's opinions or their positions aren't overriding what should be workplace decisions, workplace type of environment. So trying to balance that is something that could take some work. And then first part of June, in Texas at least, and I know I listed this, we've got quite a few clients here, the Texas Supreme Court has blocked Austin's paid sick leave ordinance. So that is on hold right now. The Supreme Court wouldn't even hear the arguments for it. And so we're expecting that decision to also affect the Dallas and San Antonio ordinances that were similar. So we're keeping an eye on that, but for right now, none of the cities in Texas have those ordinances in effect, and it looks like they're going to be stopped permanently. And then last week, the United States Supreme Court ruled that the Title VII of the Civil Rights Act of 1964 does in fact provide protection not just for race, religion, national origin, color, and sex, but that sex would include the LGBTQ community. So what that means is gender identity and sexual orientation are now protected by law. So the rules and the policies that your company has out already for anti-harassment and anti-discrimination, we're going to need to update those to include some specific examples related to LGBTQ community. And then in practice, some of the things you might see over the next few months is maybe gender neutral bathrooms. Those might be something you'll need to address, maybe your dress codes. So watch for that and kind of plan ahead and be thinking about who you're going to bring in to consult with you on that or answer the questions and get you set up to handle that. Then this week, we've had a couple of states, again, that we're heavy in, Texas and Colorado. Colorado has extended their state of emergency for COVID-19 for another month, and that's because their cases are rising. And not just in their own state, but what they're seeing is the surrounding states. Their increases are also having a flow over effect into Colorado there. So trying to roll back out some of the precautionary moves that we were rolling back. We're going to have to start handling those again. Same thing in Texas. The spread of coronavirus, of COVID-19 has gone up again. And I'm not sure exactly what the percentage, there was we had gotten it down to like a 5% contraction rate. And just last week, the governor said 10% is kind of where he wants to stay under. And just a couple of days ago, it was 9.5. So that's kind of showing you how quickly and how rapidly it's moving up. So what we're doing here is we're going to review our reopen process because it looks like we might have to roll back and then reopen again. So I know we got to a point where in some states or some businesses, I guess up to like 75% capacity, we were really across the country kind of moving forward. A lot of states are not requiring masks, just suggesting them. All that's being rolled back right now. And so as maybe we have to shut down our businesses again, or maybe someone even contracts coronavirus in your business, or you have a widespread breakout in your business, you may have to close down the entire company again for the 14 days while everyone quarantines, just to be able to go back to normal business practices. So we may have to reopen a couple of times. So what we want to do with that is make sure we're involving all members of management in the decision process. And I'm going to encourage you to do this on a more frequent basis. Have meetings regularly and frequently. Get other people involved, maybe that you normally wouldn't. Again, we already talked about some of your HR staff, or maybe some field managers that aren't always in your executive meetings. Keep bringing those folks in and do it on a regular basis. This is going to help you know the temperature out there in your company and take a quick survey, kind of get the lay of the land, but also it's going to help you process through what you need to do in these cases of the racial protests, the new laws, the LGBTQ protections, and the COVID-19. These are all on the currently happening, and on the landscape, we've got hurricane season coming up. Flu season will be in just a few more months, and we need to be watching what's going on around us. I will say, and as far as keeping everyone involved in the process, here's my good example. Starbucks, when the Black Lives Matter protests kind of ramped up, sent out a statement that their employees were not allowed to wear Black Lives Matter shirts while they're on the job. And less than 24 hours later, the very next day, they retracted that and said, okay, no, our policy is our employees can wear Black Lives Matter shirts. And whether it's right or wrong for them to wear Black Lives Matter shirt, or it doesn't. That's not the biggest damage that happened because of that. What happened because of that is they made a position statement. There was a lot of social backlash, and then the next day they changed their position. So which position are you, Starbucks? Do you really support Black Lives Matter, or do you really not? And so, and did you make the decision because you really truly changed and listened and changed your position, or because you got so much social backlash you didn't want it to affect your business? So overall, that was a disaster of a rollout. And that's kind of what we're saying you don't want. Whatever decision you make it informed at the time, so you're thinking ahead and you're not changing it and causing more confusion with your community, with your customers, and with your employees. So again, kind of try to stay ahead of what's going on. A good way to do that is to monitor all these public agencies, subscribe to your city or your county, your state, municipalities, get on their websites, get on their text notices so that you're getting right away the information as it's coming out. The Department of Labor, the CDC, the Equal Employment Opportunity Commission, and even your unemployment commission in your state, these are places that you should be either already hard linked into or that you're checking every day or two. And we'll have a list of that at the end for you. And finally, one of the other things that is still going on is the Small Business Association Paycheck Protection Program. So if you got the PPP loan to help out during the COVID-19 pandemic, there is a deadline coming up for June 30th. The forgiveness application, so you can get that loan forgiven, right? So that application was issued 2 or 3 weeks ago. Folks are filling it out. Your lenders are working with you. But just know that you've got to have those employment levels and salary levels back up by June 30th. So I want to throw that out there because we're planning. So that's something you can continue to plan for. As some of you know, ESI was on the forefront when the PPP loan first came out. We were assisting our clients and offering the service to businesses in the community to help with those applications. And so we processed numbers and numbers of those. And as the forgiveness applications are needing to be turned in, EESI is here to provide the reports from your payroll, help you fill that out, or at least answer your questions for it. We do already have some reports that you need to complete that application for forgiveness, and our software vendor is continuing to update those reports and push out new ones as they're able to help with that process. All right, so now you kind of logged into planning, you're meeting regularly, and we're going to move into the rest of our presentation. I'm going to turn it over to Norma.
Thank you, Cheryl. That was a lot of great information. As Cheryl mentioned, we're going to speak next to how to return employees to their new work environment. When evaluating your staff needs, you should ensure that your decisions are based on criteria consistent with legitimate business needs. As a best practice, an offer to return to work should be in writing. It should include a clear date by which the employee must respond and include language that failure to respond by the given date will be treated as a refusal to return to work. It's also good to include a statement in the offer that refusal to return to work may disqualify them from unemployment benefits.
Hey, Norma, if I could interrupt real quick, we've had this question quite a bit in the HR department. What if an employee refuses the offer to come back?
It's a good question, and you're correct, it does come up often. First, you want to understand why the employee is declining an offer of reinstatement. Documentation is so important. So make sure to document when an employee declines an offer for work. Being nervous about the coronavirus likely won't be enough to legally protect an employee if he or she refuses to come back to work. Unless the employee has a legal justification, refusing to work may constitute a resignation from employment. However, if there is a legitimate reason for declining, here's some things to keep in mind. You do not have to pay them or permit paid time off or vacation. Remember, if there is a qualifying reason though, they may continue to receive unemployment benefits, so pay is not required. They may be eligible for state or local mandatory sick leave. They may qualify for leave under the FFCRA, of course, if they meet one of the 6 reasons for qualification. Also remember that if the employees were furloughed or laid off prior to April 1st, they do not qualify for the emergency paid sick leave or emergency FMLA due to the fact that the act was not effective until April 1st. It's important to acknowledge that everyone may have different needs and you may need to make some accommodations. So now that an employee has accepted an offer of reinstatement, or we hope, a new Form I-9 will need to be completed. The U.S. Department of Homeland Security, or DHS, has announced new guidance for Form I-9 completion, including implementing a temporary policy for acceptance of List B expired documents in response to the pandemic. List B documents are identity documents for I-9 purposes. Because many areas are under stay-at-home orders due to COVID-19 and some online renewal services have restrictions, DHS recognizes that employees may experience challenges renewing a state driver's license or a state ID or other List B identity documents. Specifically, DHS instructs states that have not yet auto-extended expiring license B documents to record the document information in Section 2 under List B as applicable and enter the word COVID-19 in the additional information field. Beginning May 1st, identity documents found in List B set to expire on or after March 1st may be treated the same as if the employee presented a valid receipt for an acceptable document for purposes of Form I-9. So if an employee hired May 7th gives you an ID that expired March 13th, that is an acceptable document for now under List B. This temporary guidance was set to expire on June 18th, but was extended for an additional 30 days due to ongoing precautions related to COVID-19. Some other guidance that they issued was employers with employees who are taking physical proximity precautions due to COVID-19. They actually will not be required to review the employee's identity and employment authorization documents and the employee's physical presence. However, employers must inspect the Section 2 documents remotely, either via chat, fax, or email. They'll want to, again, document COVID-19 as a reason for the delay in physical inspection and the additional information field. And once normal operations resume, they will need to physically examine those documents and again, add the date of inspection to the additional information field. Something else to consider when returning employees to work are possible accommodations. The Equal Employment Opportunity Commission, or the EEOC, continues to enforce EEO laws during the pandemic, including the Americans with Disabilities Act. You will need to consider when and how to ask about health issues. Do any of your new pandemic-related company policies violate the rights of your employees or job applicants? How are COVID-19 safety measures impacting those with disabilities? And are you considering reasonable accommodations? It's important to remember that applicants and employees are protected by the ADA during a pandemic. This is also a really good time to review your policies to ensure compliance in areas such as disability-related inquiries and medical exams, hiring and onboarding, pandemic-related harassment due to national origin, race, or other protected characteristics. That's a really important one. Taking into consideration everything we talked about when returning an employee to their new work environment is one of the best guidances we can give y'all. Now I'd like to turn it over to John, who is going to speak to us about workplace safety.
Thank you, Norma. I'm going to cover, go ahead and go to the next slide, please. Thank you. I'm going to cover a general duty clause, the published practical guidance of preventing the spread of COVID-19 that OSHA sent out, I think, in March, classifying workers' exposures, a little bit on OSHA record keeping, OSHA logs, and then lastly, best practices COVID-19 checklist. So the pandemic started in March, I think it was, and OSHA is scrambling to help all the businesses with their safety programs, and they didn't have a safety standard for COVID-19. Who would have think they needed one? Didn't hear about COVID-19 ever. So they're trying to get caught up just like we were and trying to help the businesses be safe. So they relied on what's called a general duty clause, which requires employers to provide their employees with a workplace free from recognized hazards likely to cause death or serious physical harm. Well, that could be a COVID-19 situation, could be. So the OSHA inspectors back in March, they were kind of in that lockdown mode. They weren't going out and see businesses to do safety inspections. But then they got some political pressure to get out in the field and continue on, and they were started to get back in the swing. And they want to see what businesses are doing to protect their employees from a COVID-19 risk. So what they'll use is the general duty clause, since we don't have a safety standard in place. So the likelihood that you get a citation if an OSHA inspector is to show up at your door, probably not, because they know you're trying to improve the workforce from a COVID-19 threat. But just to let you know, from an enforcement standpoint, they could use the general duty clause. So just wanted to make that sure that you understood how things work with OSHA right now. OSHA also, back in March, didn't have a standard, so they prepared a guidance called Guidance on Preparing Workplaces for COVID-19. And this is kind of a primary tool to help business owners manage the risk. So what I've done is taken bits and pieces out of that guidance. It's about 35 pages, so I'm not going to cover all that, but I got some key points I wanted to share with you. Next slide. What they did is they created 4 hazard groups, and they classified them: very high exposure, medium, and low exposure. So you kind of need to know where you fall in as a business, what group you are from a risk standpoint. So the very high exposure are the healthcare workers, doctors, nurses, first responders. These are the heroes. These are the guys that are coming in contact directly with the COVID-19 patients. The next group is the high exposure, and they're kind of the healthcare support staff, medical transport. Again, they come in direct contact with the COVID-19 patients, so they're definitely at a risk. Then the medium group and lower exposure groups are probably where most of our clients are. The medium group is for if you've got an employee that does come in contact with maybe a customer or coworker within 6 feet on a routine basis. Who knows if he or she has the virus, but it's easily can be transmitted because they're so close to each other, and they're probably not wearing masks. So that group could be considered a medium exposure. And then the lower risk would be employees or workers that don't come in contact with others so closely. They're not within 6 feet that often, so they would be a lower risk. Next slide. So what do we do now? OSHA's saying, well, you have a threat. COVID-19 is real. What are you going to do about it to protect your work areas? And determining this, typically what you'll see, and this could be for any kind of hazard, whether it's fall protection or whatever, you got a table saw, well, you put a guard on it. That would be an engineering technique. If you don't have anything else you can do, you're going to make safety policies and rules and procedures. That would be the administrative side. And lastly is the personal protective equipment. What kind of protection can we put on ourselves to protect us from this hazard? In this case, for COVID, it's going to be the face mask. So you always look for engineering, administration, and personal protective equipment as the 3 areas to make your work areas safer. And as you can see, we're in that 6 foot separation, and some picture shows, and wearing the mask. That's been a very common theme for us for a few months here. Go to the next slide. So under the general workplace controls, if business owners can increase their air handling efficiency, their air filters, that would be cool if they can do that. If they can increase the ventilation rates, again, that's not another area in engineering controls that maybe you can do. Maybe they need to install the clear plastic sneeze guards. You've seen that at businesses all over the place today, which is great. For administrative controls, encourage sick workers to stay home. There's no reason they need to get to work and infect your other workers. So you need to pay attention to your workers' health. Can you minimize contact among pretty much anybody? Workers, customers, suppliers, clients. Can you replace the face-to-face meetings? Do virtual communication or telework, maybe, is that feasible? If you're a large facility and you have lots of employees, can you reduce the number of employees in that facility? Different shifts, alternating days. And then lastly, provide workers with the COVID-19 risk factors. You need to let your employees know exactly what's going on. You shouldn't be hiding anything from them, and get them protected if they need to be wearing additional protective clothing. Big area that you need to promote is personal hygiene. That's something that you really need to focus on. You should have tissues, hand soap, disinfectants, and disposable towels available all the time. Remind your employees to wash their hands continually. Maybe put a sign in the restrooms that remember to wash your hands. On PPE side, the face mask, it could be different types of personal protective equipment that are needed. All depends on the task at hand with the worker. Remember to inspect your PPE regularly and clean it, keep it clean. Next slide. So on the lower exposure workers, OSHA is saying from engineering control, there may not be so much needed, depends on the task. Definitely look into it. You always want to make things safer. But if they're not within 6 feet of somebody, you may not need to do any kind of engineering controls if there is something there. You should monitor the public health communication. Here in Bear County, we are listening, or we have these briefings on TV all the time from the county judge and the mayor. They keep us up to date on what's the latest on the COVID cases, and which is good, and give us the recommendations we should be listening to. I will tell you, Texas isn't doing well right now. We're trying to flatten the curve, but in fact, yesterday, Texas reported all-time high, daily high in new cases. 5,489 new cases were reported. That's not the direction we want to go. We want to reduce the cases. So we need to get everybody's help on this. From a personal protective equipment standpoint, we may not need additional equipment here for a low risk worker. Remember, they're not really within 6 feet of people all the time. It's not a bad idea depending on the situation. Got to monitor their actions. On the medium workers, medium exposure workers, here you probably do want to step it up. You want to maybe put in some clear plastic sneeze guards where you need to do it to keep some distance away from other people. You're probably going to be offering face masks. You want to minimize the face-to-face contact with other people. Have a strategy on how you can control this risk, and remember to document everything you're doing in this administrative controls. And it's a good idea to do that. I think the non-contact thermometer is a great idea. I went to a restaurant the other day and they checked me, which is great, but the guy was not wearing a face mask. So I thought that was not the smartest thing. But, you know, we're all learning here. We're not all the best at this type of risk. It's new, but we can do better. We just got to monitor and watch each other. And then the personal protective equipment, the face mask is something that would definitely probably be needed for the medium exposure risk. Next slide. So on the very high and high exposures, they grouped them into one slide here. In engineering controls, it says air handling systems and airborne infection isolation rooms. Now, these are like medical facilities. They should already have these things in place because they are at the highest risk with the COVID-19 contacts that they're making. So they should have facilities really good to go to protect themselves from the exposure. On the administrative side, they're going to probably be stepping up their policies and plans on how they do their work, their processes. You know, I had a doctor appointment the other day, and they don't let me come right in. They tell me to make a phone call when you park and where you're parking, and they ask you the COVID protocols, how you're feeling, and tell me what the process is going to be. It's not the good old days where you just walk in and sit down and, you know, wait for your doctor to be seen. So the procedures and policies by the high risk and very high risk exposures at the clinics and so on are really going to step up their policies, which they need to do. And of course, they're going to be wearing more personal protective equipment. The doctor visit I had, the doctor was wearing a full face shield and a face mask, which wasn't always the way. So just keep that in mind. All right, moving to the next slide. little bit on OSHA record keeping, and not all companies have to have OSHA logs, the 300 series. There's quite a group of industries that are partially exempt. If you're not sure, you can reach back to us and we'll connect you on requirements. The companies that do have OSHA logs, we put them on the client portals, and you should see that every January. So you kind of know if you're using them or not. In this case, OSHA kind of went back and forth on the requirement for documenting COVID-19 cases onto an OSHA log. And they've always had the medical community document like needle sticks and infectious disease type situations, cases onto an OSHA log. But they never required non-healthcare type of industries. But now they do. So even if you're not in the healthcare community and you had a COVID-19 case, a positive case, you might have to put that case onto an OSHA log. So here's the requirements. It says per OSHA that one, they need to be sure they have a COVID-19 case, which you can find out from the doctor pretty quick once they've been tested. Is the case work related? I'm going to go into that a little bit. And then the other part of this is it a death? Is it days away from work, restricted duty, transfer, or medical treatment beyond first aid, or loss of consciousness? If all those things apply, then it could be considered work-related. And this is a judgment call. The key is it work-related. Go to the next slide, please. So OSHA kind of set up two groups. They have a determining work relatedness and it's likely work related. Then they have another section called not likely work related. So it says if it's work related, are there several cases developed among workers who work closely together and there is no alternate explanation? So if you have a guy that's got a COVID-19 case and the next day you got 2 more workers that have it, and the next day thereafter you might have 3 or 4, so now you got 6 or 7, 8 people in your workforce that have a COVID-19 case. Guess what? It's probably work related. Maybe not the first guy, but the second, third, and fourth guys got it from work. Now, if you had an employee that contracted shortly, got the illness shortly after a lengthy visit with a customer or a coworker or whatever, that could be considered a COVID-19 case if there's no alternate explanation. They don't know if they didn't get it away from work. So that's a possibility. So again, this is strictly a judgment call. And then last is job duties include having frequent close exposure to general public in a locality, ongoing community transmission. So if someone comes in from a state, maybe, I don't know, Montana or whatever, they drive it in and San Antonio is a high risk transmission state because Montana wasn't, and all of a sudden this guy gets COVID-19, that could be possibly, it's a work related situation that can be considered a COVID-19 work related case. And that's a tough one to call, but if there's no alternate explanation, what are you going to think? Now, if it's not work related and you only got 1 worker and that's the only person that contracts it, it's probably not work related, and that worker might be able to tell you he or she where they got the virus from, infection from. And then there's job duties that include frequent contact with the general public. Maybe they don't have frequent contact with the general public. So in that case, it might not be considered work related. And then lastly, if they know they probably got it from a family member or a close friend who does have COVID-19. So in that case, it would not be considered work related. Next slide. So best practices, here's a checklist. The biggest thing I think is stay up to date on what's going on. You've got to be paying attention to your local authorities, your healthcare folks. They are going to tell you what's current. And communicate this stuff to your employees. Keep them up to date because they might not be watching the news. Sometimes it gets kind of tiring to see the same old, same old. So you need to know what's going on, stay abreast to the latest, and then train your employees on what's going on. I think good protocols is always washing your hands, social distancing, avoiding touching your face is important. You could have a poster on these things. In Bear County, they just started again on Monday, I think it was, that all establishments have to have a poster outside the front door saying you have to wear a face mask, and both employees and customers. So these things do change back and forth depending on the threat. You might want to have an emergency communication plan. Communicate the action being taken to prevent the spread of the illness. What are you doing? What actions is the business doing to protect their employees? And communicate that to your employees is very important, and document this also. Again, good personal hygiene, adequate supplies of tissues available, the no-touch trash cans with plastic liners, hand soap, hand sanitizers, and so on. Encourage your employees maybe to wipe down their work areas at the end of the day. Isn't a bad idea. And then also, if you have employees that exhibit some symptoms of the illness, make sure they stay home. Don't let them come to work even if they want to. They need to contact their healthcare professional. They need to get the information from the doctor, and they don't go back to work until they've got a note saying they're cleared and they don't have COVID-19, if they indeed have that. If they're sick at work, get them home. Don't let them come in contact with any coworkers. And you want to, again, find out what's going on. And if they are self-quarantined, keep in touch with them. They are isolated, and you want to make sure that they're still connected to the workforce, and you got to reach out to them and let them know that you care. And then from a business continuity standpoint, keep all your medical information. Of course, this is confidential, and plan for some absence. Some of your employees may be sick or self-quarantined, so you're going to have to plan for some of that. Next slide. So here we are. We've been in this for a few months, and I thought we'd be flatlining, but we're not. Unfortunately, the pandemic is not going to go away anytime soon. We don't have a vaccine, so what can we do? Well, continue social distancing. Keep using the 6-foot rule. Continue to wear the face mask as necessary, and if you're within someone that's 6 feet away. This will help to slow down the spread of the COVID viruses and the cases that we're seeing, but we all need to do our part. All right, at this point, I think I'm going to pass this back to Miranda.
Thanks, John. So I'm going to spend a few minutes talking about the FFCRA, Families First Coronavirus Response Act, or some of you guys might better know it as Emergency Paid Sick Leave and Emergency FMLA. As John just stated, unfortunately, this is not going to go away anytime soon. So for some of you that have maybe no employees have requested any leave, I can almost guarantee here in the future you will. So we just want to make sure you guys are aware of what's going on. So on April 1st of this year, the FFCRA was passed. The purpose for this was to provide paid sick leave and paid FMLA to employees who are sick due to coronavirus or need to care for someone who has the virus or are unable to telework and have no child care for their children. This act went into effect April 1st of this year and runs to the end of the year, December 31st. Employers do need to post a notice to their employees of this act. So those notices can be found on the CDC, DOL, or OSHA website. It covers employers who have 500 employees at the time leave is requested. It is for both full and part-time employees. And there are some exemptions. Healthcare providers and employers with fewer than 50 employees could be exempt. I will touch on that one here in a couple slides. So emergency paid sick leave. This is up to 2 weeks of paid leave. Employers either receive 100% of pay or 2/3 of pay, depending on their qualifying reason. And this is in addition to any PTO, vacation, or sick policy you might already have in place. And there is no waiting period for an employee to be eligible. So an employee could have started last week and be eligible this week if they're requesting the leave. So this slide shows the 6 qualifying reasons to be eligible to take leave. Reasons 1 through 3 are paid at 100% of the employee's rate of pay. And then reasons 4 through 6 are paid at 2/3 of the employee's rate of pay. So essentially, if the employee has COVID or seeking a medical diagnosis due to suspecting they have COVID, they will receive their full rate of pay for up to 2 weeks. And if they are caring for an individual who has or suspected to have COVID, or they don't have childcare due to COVID, they're eligible to receive 2/3 of their normal pay rate for up to 2 weeks. So now we're going to talk about Emergency Family and Medical Leave Act. So this is paid leave to care for your child due to school or daycare being closed for COVID-related reasons. It is up to 12 weeks of paid leave. The first 2 weeks are unpaid. The employee could use other accrued leave, such as that vacation, PTO, sick time, or reason number 5 of emergency paid sick leave, if they have any of that remaining. Employees must be employed for 30 days prior to requesting the leave to be eligible. We received a question regarding how do employers with less than 50 employees, how are they exempt from this? So the exemption would only be for employee emergency paid sick leave, reason number 5, and emergency FMLA. And that is the ones that are an employee caring for their child whose school or place of care is closed due to COVID-19 reasons. So to be exempt, the employer would have to show that doing so would jeopardize the viability of their business. So on this slide, it shows a little bit of more what the employer needs to do to determine if they can be exempt from emergency paid sick leave reason number 5 and emergency FMLA. So you would need to have an authorized officer of the business. They would need to determine one of the following. So if granting emergency paid sick leave or emergency FMLA would result in expenses and financial obligations exceeding available revenues and cause operations to cease at a minimum capacity, or they would need to determine the absence of the employee requesting emergency paid sick leave or emergency FMLA would be a substantial risk to the financial health or operational capabilities because of their specialized skills, knowledge, or responsibility, or they would need to determine there are not sufficient workers who are able, willing, and qualified and who will be available at the time and place needed to perform the labor or services provided by the employee requesting emergency paid sick leave or emergency FMLA. I wanted to touch on the documentation requirements for emergency paid sick leave and emergency FMLA. So it is requested that you have a standard form to use for all these requests. This talks about what information does need to be included on these documents. ESI does have a standard form for our clients to use. We will be including that as a part of the material that we'll be sending with the presentation materials today. And just briefly wanted to touch on the record retention for these documents. Employers need to keep all documentation for 4 years. And this is regardless of if the leave was granted or denied. Now that summer is upon us, we have been receiving questions from clients how that affects emergency paid sick leave and emergency FMLA. So we wanted to answer some questions. So one of the questions was, does the end of school mean the end, at least temporarily, to paid sick leave or emergency FMLA triggered by school closure due to COVID-19? So according to the Department of Labor, the answer is yes. Paid sick leave and emergency family leave are not available if the school is closed for some summer vacation. And then is paid sick leave or emergency FMLA for childcare still available in the summer? And that would be yes. So if summer childcare is closed or unavailable due to COVID-related reasons, and this would include summer camps, then they would still be eligible. So now we're going to shift gears a little bit and talk about re-engaging the workforce. These are very uncertain times for employees, employers, and how businesses respond will have a lasting impact on their employees. Here are 16 tips to help re-engage your workforce. I'm just going to touch on a few. Some of them have already kind of been talked about earlier, but the first one I wanted to touch on is employee surveys and check-ins. So it's always good to just, check the workforce. How are they feeling? How are they adapting to this new normal, as people say? Are they feeling safe? Is there any other stuff that can be done? So communication is key, and I think it's good for them to know that they have a voice in the company. The next one is goal setting. Do you have goals established for 2020 that may need to be readjusted or are no longer obtainable? So at the beginning of year, before all this stuff happened, sales goals might have been one thing, and as times have changed, those may need to be reevaluated with the employees. They don't need to be stressing out over goals in case things have changed and we need to kind of rework those. And then gratitude. A simple thank you or well done can go a long way. So try to show gratitude when possible, encourage others to do the same. So, you know, say thank you. I think people forget something so simple really does go a long way. And then finally, connect virtually. Make time to stay connected even in a time when being in person is difficult. So, I mean, a lot of employees here are not used to working remotely. So it's good, you know, maybe those one-on-one meetings that you're holding, instead of just doing it over the phone, maybe do it virtually so that you guys can connect and kind of have a little bit more of that, that bond with your employees. It doesn't necessarily always have to be work-related. Here at ESI, we shut down early one day and hosted a quarantini. So we played some games and just get reconnected with each other on kind of a non-work level to kind of help us find our new normal. So those are some tips to re-engage your employees. I'm going to turn things over to Norma to wrap things up for us.
Thanks, Miranda. I just want to touch on some key takeaways from today's presentation. We want to remember to document your return to work plan. Keep in mind that, as we stated throughout the presentation, COVID-19 is an ongoing threat and planning is key. Remember to always try to keep a clean and safe work environment. And above all, you cannot do it alone. Here at ESI, we're here to help you and guide you all the way. Lack of information breeds fear, so inform your management and employees of your plans. The best things you can do, keep the lines of communication open. We also want to recommend that you visit the following websites for further information. And as Miranda mentioned earlier, we will be emailing a copy of the presentation along with supporting documents and guidance to all of the attendees. Here, we will be responding to any questions that may have come in through the registrations individually. So look out for those answers from our HR team here. We want to thank you for joining us today. Here at ESI, we will continue to educate ourselves on this ever-changing topic and work hard to keep you all informed and up to date. Please make sure to follow us on all your social media platforms for a lot of more information and upcoming events. Thank you again, and hopefully we'll see you again soon.